All right, team. The patient presents with symptoms of plantar fasciitis, blepharitis, and viral cardiomyopathy. What do you think we're dealing with here?
Based on those symptoms, I would say it could be a systemic issue affecting multiple organs.
I disagree. I think it might be more localized considering the specific nature of the symptoms.
I'm leaning towards an autoimmune condition affecting the connective tissues.
It could also be a rare genetic disorder causing these diverse symptoms.
Stop wasting time. Spastic ataxia, corneal dystrophy syndrome. We need to act fast. Get ready for the Krukenberg procedure.
But doctor, that procedure is extremely risky. Are you sure that's the right approach?
Damn it. I didn't spend years in medical school to have you question my judgment. We're saving this patient's life. No time for doubts. Prepare for surgery now. Tracy, thanks for calling me in. I really need to discuss the Krukenberg procedure for my patient with spastic ataxia. Corneal dystrophy syndrome.
Hawks, I'm concerned about this. Are you sure it's the right course of action?
Of course, I'm sure. I've been a doctor for over 20 years, and I know what's best for my patients. Trust me on this.
I understand that you have experience, Hawks. But let's not forget your track record. You've been wrong before.
That was different, Tracy. This is a unique case, and I know in my gut that this is the right move. Trust me, I won't let you down.
I want to trust you, Hawks. I really do. But we can't afford any more mistakes. Just promise me you'll think this through thoroughly before proceeding.
I promise, Tracy. I'll cross all my T's and dot all my A's. This patient deserves a chance, and I won't let them down.
Leslie, we have a critical situation here. The patient is not doing well after the Krukenberg procedure.
Oh no, that's terrible news. I hope we can still help them.
I don't know how to break it to Hawks that the Krukenberg procedure was not the right choice for spastic ataxia, corneal dystrophy syndrome.
I understand your concern, Frank, but right now our priority should be the patient's well-being. We can deal with the repercussions later.
You're right, as always. Let's focus on what we can do to help the patient now.
What the hell were you thinking?
You nearly killed our patient with your incompetence. Wrong Krukenberg procedure and wrong diagnosis. Are you all morons?
I still think it was a case of acute pancreatitis. It just wasn't presenting in a typical way.
No, I'm pretty sure it was a case of cholecystitis. The symptoms matched up perfectly.
Actually, I believe it was a combination of both conditions leading to a rare complication.
I think we should consider the possibility of a pancreatic tumor causing the symptoms. It couldn't have been a straightforward case.
None of you have a clue. You're all a disgrace to this team. I'm done here. Figure it out yourselves. So, how's everything going outside of work, Johnson?
Not too bad, just trying to juggle family time with work. You know how it is.
I actually don't. There's a reason I'm child-free and single, but that's not important. I've been engrossed in this case lately. It's quite fascinating.
I get it. Work can really consume you sometimes. But it's important to find that balance, you know. What? What have you figured out?
I have to go. Thanks for lunch, Johnson.
Wait, what? You're leaving just like that?
Sorry, duty calls. I'll catch up with you later. I need to talk to you all about this patient. Spastic ataxia, corneal dystrophy syndrome was wrong.
Hawks, what are you doing in here without protective gear? You know better than that?
Seriously, Hawks, you can't just storm into the operating room like that. It's not safe for you or the patient.
Yeah, this is completely unacceptable.
We have protocols for a reason.
Listen, I know what I'm doing. The real diagnosis here is gastroenteritis.
Gastroenteritis? What's the prognosis, Hawks?
Prognosis is good with proper treatment. The patient should recover fully within a week.
Well, I guess we'll go with your diagnosis then. Just please, next time, follow the safety protocols.
Agreed. We can't have any slip-ups when it comes to our patients' well-being.
Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. You really saved the day on this one.
It wouldn't have been a problem if I didn't have such idiotic doctors on my team.
Wait, what do you mean by that? You were the one who declared the wrong diagnosis initially.
Well, my diagnostics team should have caught it sooner.
You can't just shift the blame, Hawks. You made the call.
Sighs, I need some air. stands up abruptly and leaves.
We need to talk about this, Hawks.